Good afternoon, morning, evening, everyone, wherever you are in the world. We are thrilled to welcome you to this, our final global webinar for 2023 with Dr. Gabor Maté, a dear friend, a beloved human being who's sitting there today. Hello, Gabor. It's beautiful to have you with us today. And I'll soon be introducing you. So thank you. Thank you for everything you do in the world and the healing that you bring through your work. It's extraordinary. And to all of you who are on here, maybe just put your little hand up symbol if this is your very first time to a Mind Medicine Australia webinar. Little hand in the chat, or a hand up, or a physical hand, lots and lots of you. Well, welcome to Mind Medicine Australia. We will give you a very short introduction to what Mind Medicine Australia does, and then we'll be introducing Gabor. To begin with, we'd like to acknowledge the lands from which we all come, their elders past and present. We also acknowledge the wisdom keepers, those who've brought these medicines and ancient wisdom to us today so that we can actually be here and be able to be healed using ancient medicines and ancient wisdom, which is so important in such a troubled and divided world. So it's wonderful that we can have people like Dr. Gabor Maté and some of the others who've been speaking on our webinars. Some of you may have been with us a couple of weeks ago with Dr. Bessel van der Kolk. And in February, our first webinar will be with another really good friend of Gabor and mine called Wade Davis, the wonderful anthropologist. And we encourage you to join Wade Davis. He's an incredibly wise and interesting human being. So we're going to start off now with a short video. Actually, I'll just, Ilan, can I share the slides now, please?
Yes.
That's great. And they're full screen. Can you confirm that to me?
Push Control L.
Control L. Okay. Hopefully. Okay. Excellent. Thank you, everyone. And, if you want to put in the chat where you are in the world, that would be fantastic as well. Before we show this video, I'm just going to remind you all that our charity is apolitical and a-religious. We're focused on the development and use of evidence-based psychedelic-assisted therapies within regulated healthcare systems. Can we just turn off whatever mics are not on mute, please, Alana? We don't encourage the use of psychedelic medicines outside of this context because obviously it's very important that anyone who uses these treatments does so with proper guidance and support. And that's not to say that there's not excellent underground practitioners, but please do your due diligence. These webinars are educational and they don't constitute medical advice. We have a massive mental health crisis in Australia at the moment. 1 in 4 Australians have a mental illness and 1 in 7 Australians are now on antidepressants, including 1 in 4 older people and 1 in 30 kids as young as 4 being prescribed with psychiatric medications, including their significant side effects. This comes at a massive cost to the potential of all human beings and costs society a lot of money. The elephant in the room for the past 5 decades has been the lack of innovation in treatments for mental illness. And you can see there, the elephant's trying to get the attention of the bureaucrats, saying the current treatments aren't working. What are we going to do about this? So in the case of depression, only a maximum of 35% of patients go into remission from current existing treatments. And in the case of post-traumatic stress disorder, as few as 10% of people are going into remission from existing treatments. As I mentioned before, the side effects are high. There's high relapse rates. And we have many wonderful clinicians. I'm sure that many of you are clinicians. And again, thank you for everything that you do in the world, because we need you. And we need to make sure that you have enough tools in your toolbox to treat the complex conditions that people are presenting with. We're a charity and we're focused on alleviating suffering through a whole of system approach. Our goal is to expand the treatment options available to practitioners and their patients, and we're particularly focused on psilocybin, MDMA, and ketamine being used in the health system in clinical environments. For us, success means that these therapies become an integral part of our mental health system, that they keep achieving the incredibly high remission rates that they've been achieving around the world, which is 60 to 80% remission rates after just 2 to 3 medicinal treatments of psilocybin or MDMA with a short course of psychotherapy. And as a charity, it's really important to us that these medicines are accessible and affordable to all those who need them. We'll talk further about that in a moment. Ilan, if you could come down here, I'm just not getting the right view on my computer, and I'd really love that. Thank you. Thanks so much. I just need to see. Sorry, just a moment. We'll just get this set up properly. So in the case of medicinal psilocybin, it's used for depression, and in the case of medicinal MDMA for post-traumatic stress disorder. And both of these medicines are also being used for a whole range of other conditions as well. Sorry, I'm just getting the view on my computer sorted. As I mentioned before, we only need 2 to 3 dose sessions in contrast to conventional treatments, and the medicines are curative, not palliative. There have been incredible safety results in all the clinical trials with thousands of patients. There have been no serious adverse events, and there's no evidence of addiction. Both of these medicines have been granted breakthrough therapy designation by the FDA in the United States, which is only granted to medicines which could be vastly superior to existing treatments. As I mentioned, we're also interested in ketamine-assisted therapy, especially for the treatment of depression, but it needs to be used more often than psilocybin or MDMA, which can often lead to remission after just the 2 to 3 treatments. Oh, where's our little circles? Okay. So Gabor is going to talk a lot about trauma and mental illness, and I'm sure he'll be talking about some of the work he's done with psychedelic-assisted therapy, so I won't go into too much detail. But we will watch the video in a moment. So I'm going to introduce that just after we've talked about our core strategy. So our goal at Mind Medicine Australia is to build the ecosystem. So we do that through events like these, this global webinar series, other educational events for different stakeholder groups like clinicians, researchers, regulators, the general public, patients, and so on. We also part fund clinical trials. We have chapters all around Australia. We run global summits, and we're always focused on the data and science and evidence behind these treatments. We also run one of the world's leading professional development programs in psychedelic-assisted therapies, which is our certificate in psychedelic-assisted therapies. And we've already trained over 360 psychiatrists, psychologists, doctors, counsellors, nurses, social workers, occupational therapists, and others in these therapies with a world-leading faculty, which includes people like Professor David Nutt, Dr. Rick Doblin, Bessel van der Kolk, and Gabor also sometimes teaches within that faculty. We also have other short courses as well. We also managed to unlock $15 million worth of federal grant funding towards trials in Australia, which is the largest federal grant ever provided by any nation in the world. And as I mentioned, we're funding a number of trials at the moment, one which has just recently been announced, which is a healthy persons trial for graduates of psychedelic assisted therapies programs, including our CPAT course. We're also very focused on making sure that the medicines can be available for trials in clinical practice at the most cost-effective pricing possible. And we've organised very high quality medicine supplies for Australia. We're also partnering with many clinicians and clinics to ensure that they can roll out clinics and provide the best operating procedures and protocols to deliver these treatments in. And we're a charity, and we have a patient support fund to enable patients who may not be able to afford the full costs of treatment themselves to gain some support. But that's dependent on donations. And one of the things that we really rely on through our community, like all of you, is your donations and generosity. Because whilst Peter, my husband, and I are philanthropists who founded this charity, we could never have done this alone. We rely on the incredible generosity of other philanthropists, large and small. It can just be 2 cups of coffee a week that you donate, or whatever it happens to be, to larger donors with larger capability. But to do what we're doing takes a lot of resources, a lot of persistence, and we need everyone's support. We have this wonderful advisory panel, which Dr. Gabor Maté and others are on, and ambassadors, and a lived experience panel, a wonderful team and board. And if we're not for all of those people and our volunteers, we wouldn't be able to do what we're doing today. So one of the really big things that we achieved in Australia, which hopefully most of you know about, is achieving the world's first rescheduling of psilocybin and MDMA earlier this year on February the 3rd. And you can see the headlines, just some of the hundreds of headlines here that occurred after that very exciting decision was made by a therapeutic goods administrator. And, oh dear, okay. And that now means that authorised prescribers can prescribe these treatments once they get the approval of an ethics committee, which is extremely important. And we're now seeing a number of psychiatrists in Australia who are starting to be able to prescribe these treatments to their patients. So we'll talk further about that as part of the Q&A if you'd like. Just one moment. So I mentioned the Wade Davis seminar, and this is about our certificate in psychedelic assisted therapies. And at the moment, we're finalising 5 to 6 intakes for this program in 2024. We had a huge waiting list for our intakes in 2023 and have just completed the training of 120 practitioners from around Australia and New Zealand and other parts of the world. And our applications for 2024 close on December the 31st. And on the 1st of January 2024, our prices will go up for the course because the costs are increasing, and we're a charity, so we can't afford to make a loss on the course. So we really encourage you to apply now. Do your interviews for the course now. They're very quick and very easy and not a huge hurdle. And this is a wonderful opportunity for you to be a pioneer and be at the front as an early adopter of these treatments and add psychedelic assisted therapies to the modalities that you can deliver through your practice. Here's some of the people on the faculty. You can see there Dr. Geeta Vade, who's our international course director, Dr. Ali Kotler, our Australian course director, both of whom are psychiatrists, Dr. Ben Sessa, also a psychiatrist from the UK, with Dr. Lauren McDonald, who are facilitating the residentials. And if you have a look at our website, you can see the extraordinary feedback we've got for the course. Many people have described the course as the best professional development training they've ever done in their lives. Now, how can you help? Lots of people say, well, how can we help your charity? Well, apply for our CPAC courses I just mentioned, volunteer and join our chapters. We have an amazing Learn section on our website with videos. We also have wonderful opportunities to make us your charity of choice for your workplace, to fundraise for us, to follow us on social media, and to talk to other practitioners, your GPs and other clinicians and healers, about psychedelic assisted therapies, and direct them to Mind Medicine Australia's website so they can learn more, so that we can remove the stigma and taboo that still remains connected to these treatments, though it's going faster now. And please join our events, many of which are free and which we encourage you to make a donation for. Donations support financial assistance towards practitioner professional development. So we do provide a certain amount of financial assistance places to practitioners working in high needs communities who otherwise wouldn't be able to afford the training. And we also continue to build our awareness and knowledge part of our charity and support more research in this field. And of course, those who can't afford the treatment. So please help us in any way that you can. We also have a wonderful book of Australia's first psychedelic healing stories, 32 Australians who talk about how they've healed through these treatments. We have a wonderful set of gift cards, mushroom gift cards, which are great for Christmas and other times of the years. We have our Mind Medicine Australian t-shirts and so on. We're now going to show just a very short video, which is our little short animated video about what we do. Alana, if you could hit that, and then I'll introduce Dr. Maté to everyone.
Did you know that over 45% of Australians will experience mental illness in their lifetime? That's nearly half of us.
Everything feels flat. I can't sleep. I don't want to. I feel ashamed.
Mental ill health devastates lives and families and costs Australians around $60 billion a year. Research and treatment expenses continue to rise, yet rates of mental illness indicate that we're losing the battle. New approaches are urgently needed to address this immense suffering and cost. Psychedelic-assisted psychotherapy is currently being trialled worldwide and has demonstrated remarkable promise in treating depression, anxiety, addiction, and post-traumatic stress disorder, with new trials underway for treatment of dementia and anorexia. The treatment combines a short program of psychotherapy with just a few medicinal doses of psilocybin or MDMA. In the 1950s and 60s, psychedelic treatments had a major impact in psychiatry, and many considered it the next big thing in mental health treatment. But for political reasons, the Nixon administration criminalised the use of psychedelics and effectively stopped all research. That research has finally begun again. With proper clinical support, psychedelic treatments are safe and frequently lead to remission after only a short program, and even where current treatments have failed. Here at Mind Medicine Australia, we believe everyone should have access to the best treatments for mental illness. We will seek to establish best practice in regulated psychedelic-assisted treatment. Mind Medicine Australia is wholly focused on the clinical application of psychedelic medicines. We're preparing for change by developing therapist training, ethical guidelines, a centre of excellence in psychedelic medicine, educational material and events, and supporting clinical research. We're a small organisation doing big things, and we need your support. Please share this video and visit our website to support us and get involved.
And please do feel free to share that video, which Ilana, I'll ask you to put the link of in. So now it brings me great joy and pleasure to introduce my friend and beloved human being, Dr. Gabor Maté, to this webinar. We're really honoured to have you on this program, Gabor. We thank you for being a really important part of our advisory panel and for being a friend for the time that we've been friends for, and supporting me personally. I'm very grateful. And I just want to say that we're blessed to have you here today, and we're very much looking forward to hearing from you. So what will happen now is Dr. Gabor Maté is going to speak for a few minutes. He'll talk about the topic, and there'll be the opportunity for you to put questions into the chat, which we'll try and go through some fast speed questions once he's finished speaking with you. So over to you, Gabor. A huge round of applause, everyone. And thank you for being with us.
Thank you, Tanya. And thank you all of you for joining us. My intention, or I should say my instructions, or to speak for about half an hour and then to take questions. So the difficulty for somebody like me is not just that there's so much to say, but also that the very framework that we look at things from has to be questioned. And it's very difficult to articulate a different framework than what we're used to. So even when we speak about the treatment of mental health, mental illness with psychedelics, we're within a certain model. And that model is that of a medicalized version of mental illness. But I question that. I question that very model. As a physician, I also question the very model of how we present physical illness. So in the Western mind, when we speak about illness, we generally think about a dysfunction or pathology of some organ in a particular body. And then we think, well, maybe psychedelics fix that particular pathology. That's a medicalized view of looking at any treatment, including psychedelic treatment. But what if the very framework through which we are viewing the phenomenon in question, whether it be what we call mental illness, whether it be addiction, or whether it be physical conditions like autoimmune disease or malignancy, what if that very framework itself is lacking and deficient and incomplete? Well, that's what I'm going to tell you. And it's very difficult to get that across in half an hour. But let me begin. So when Tanya talked about these ancient medicines and how they've been used, they've not been used within a Western medical framework. They've been used in a completely different, what's the word? Understanding of what human beings are all about and what human illness and health represent. And so that's a holistic perspective. So if you look at indigenous medicines throughout the world, or the Ayurvedic medicine of India, or the Qi medicine of China, any of the tribal medicines in Africa, South America, Australia, they're not looking at isolated organs in distinct human bodies. They're talking about a holistic view in which mind and body are inseparable, and the individual is inseparable from the environment. So when we talk about psychedelic healing, it's that perspective that at least we have to keep in mind. And what is both interesting and supremely frustrating is that Western science has completely validated that ancient perspective. So then, when you go to a neurologist with multiple sclerosis and they simply focus on the physical symptoms of weakness or numbness, nerve inflammation, blindness, whatever the symptoms happen to be that are presenting, or if you go there with rheumatoid arthritis with an inflamed joint and they focus on the inflammation and how to fix the inflammation, but they don't ask you about your life and the context of your life, which generally they don't in a Western medical model. Or if you go to a psychiatrist with depression and the psychiatrist is trained to look upon this condition as a pathology of brain neurotransmitters that is simply to be modulated by giving you an antidepressant. Or if you go to an addictologist, an addiction specialist, and they focus simply on the behavior of addiction, whether it be to drugs or pornography or gambling or whatever it happens to be, but the problem is the behavior. And this behavior is thought to originate from some dysfunction of the brain. These are very limited perspectives. And we'll never understand the value of psychedelics if we're looking at it from just that particular perspective. Or at least we'll have a very constricted view of what is possible if you look at it from that particular limited perspective. So that's my first point, is that we have to broaden the framework, and I'll come to that in a moment. The second point is, why all the interest in psychedelics? What's going on? Well, there is, as Tanya already mentioned, a few examples of the demonstrated value of that particular modality. No panacea, but my God, does it offer possibilities that often Western medicine can't even dream of. So there's the intrinsic value of this particular approach, but that doesn't quite explain why it's burgeoned so much. And for that, we have to look for broader causes. And the broader causes are twofold. One is, as Tanya mentioned in the original comments, the rate of mental illness and of many physical illnesses is going up in the world, not just in Australia. In the United States, last year, more than twice as many Americans died of drug overdoses than died in the Vietnam, Iraq, and Afghani wars put together. This is decades into the so-called war on drugs. The number of childhood suicides is going up in the United States significantly. The number of children being diagnosed with all manner of conditions, from depression, anxiety to attention deficit disorders and related conditions, is going up all the time. Autoimmune diseases are on the rise. There's something going on. Now, what's not going on is any kind of genetic explosion, because genes don't change in a population over 10, 15, 20, 100 years. There's something else driving these numbers, and that something else is what we need to look at. So that's the second point, is the rising, burgeoning number of problems that we're having to deal with. The third point, which again impels or helps to impel the continued interest in psychedelics, is the, in general, complete failure of the Western medical model to deal successfully with chronic health conditions of mind and body. So we're very good. The Western medical system, in which I was trained and practiced all those years, is beyond brilliant in many acute interventions. I mean, I don't have to convince you of that. But as brilliant as it is in acute interventions, it's as lame as it can be when it comes to dealing with chronic mental health conditions and physical health conditions. The best we can do for most of these is just to manage their symptoms. But the concept of healing barely even enters into the medical lexicon. So that's my introduction. Now, a quick dive into a holistic perspective. So first of all, it's only a matter of scientific fact beyond controversy that mind and body are inseparable. I'm going to quote you at the risk of being self-serving. I'm quoting from my book, The Myth of Normal, Trauma, Illness, and Healing in a Toxic Culture. And what I mean by that title is that what we consider to be normal in this society is neither healthy or natural. Now, in 1939, there was a physician at Harvard University from Hungary, I should say from a Hungarian-speaking part of Transylvania, like myself, also from Hungary originally. And his name was Dr. Semmelweis. And Semmelweis was so respected at Harvard that to this day, to our present time, there's an annual day in his honor at Harvard University. And he said in 1939 to a lecture to a medical school class, he said, social and psychic factors play a role in every disease, but in many conditions, they represent dominant influences. Social and psychic factors play as much of a role as physical ones. Now, in Australia, for example, to look at social factors, the indigenous population makes up 2.8% of the Australian population, something like 27% of the jail population. And many more indigenous people die in your jails proportionately. For example, and in Canada, it's the same thing. And in Canada, if you look at addiction rates and diabetes rates and mental health conditions, it's much higher. This is in populations that didn't used to have such problems prior to colonization. So we're looking at a social factor. And asthma is much more common in people of color in the US and Puerto Ricans than it is in Caucasians. Nothing to do with genetics, because they don't have those same problems in their countries of origin. Those are social factors, because social factors and psychic factors affect the physiology of the body. That's just how it is. And so he said, mental forces represent as active a force in the treatment of patients as chemical and physical agents. He said this in 1939. His lecture was reprinted in the Journal of the Medical Association in 1940, and his words have been completely forgotten. He's remembered, his words are totally forgotten. So that's the first point. Mind and body can't be separated. No. Bessel, my friend Bessel talked to you a few weeks ago. Bessel said very succinctly, he said, our culture teaches us to focus on our personal uniqueness, but at a deeper level, we barely exist as individual organisms. In other words, our brains and our physiology are interconnected, they're interpersonal. So the healing that happens with psychedelics respects that unity, that it's all about context, and it's all about relationship, and it's all about the unity of mind and body, which means that people's life's experiences are not irrelevant when it comes to understanding their pathologies. So if you look at the research on multiple sclerosis or rheumatoid arthritis or anything, if you like, trauma and stress has a lot to do with it. Women with severe post-traumatic stress disorder have double the risk of ovarian cancer, according to a very recent study. And the milder their symptoms, the less their risk of ovarian cancer. So we're talking about mind-body unity in a social context. So I'm going to apply this framework of psychosocial, biopsychosocial, which means that the biology of human beings is inseparable, scientifically inseparable from the psychological and social context. And therefore healing needs to happen on a psychological and social level, which means to do with our relationship to ourselves psychologically and our relationship to others. That's the social part. And the reason, to give you a hint, why psychedelics can be so powerful is precisely they work at those levels. They're not trying to change your brain chemically. Like if you get a diagnosis of depression and somebody prescribes fluoxetine or paroxetine or sertraline, Zoloft, Paxil, any of these drugs, and I've taken them, they've helped me. But all they're doing is addressing a temporary physiological fix. But what if that depression of mine isn't simply a physical disease of the brain, which it isn't? What if that depression, and if you look at the word depression, what does it actually mean? It means to push something down. That's what it means. Now, what do we push down in depression? We push down our feelings, our emotions. Now, why would we do that? Because our early environment did not allow for the full expression of our emotions, because if we fully expressed our emotions, that brought you into conflict with your parents who couldn't accept and attune with and validate your emotions, not because they didn't love you, but because they couldn't, because of their own stuff. So then you learn to push things down in order to be acceptable. And that becomes a lifelong dynamic because you're not doing it consciously. And then you're diagnosed with this illness in a medical model. You got this disease called depression. Well, that's one way to look at it. The other way to look at it is that it's a response to psychosocial factors in your developmental phase. And I'll come to how psychedelics address that later on. Or take a condition like ADD, attention deficit disorder, with which I was diagnosed in my mid-50s, and I became the subject of my first book, Scattered Minds. It's supposed to be this heritable disease. Well, it's a, and in fact, they call it the most heritable disease, mental health condition. Well, I say, to say that ADHD is the most heritable mental health condition is like saying that quartz is the most chewable crystal. Tuning out is not a disease. It's a coping mechanism of a stressed young child in a stressed environment who can't escape or change the situation, so they tune out. When are they tuning out? When their brain is developing. The brain is the social organ. I could give you a lecture on brain development. The brain development occurs in interaction with the environment, of which the most important determinant is the child's emotional relationship with the nurturing adults. When the nurturing adults are stressed or depressed, the child is stressed. How does he deal with it? How does she deal with it? Tuning out. That gets wired into the brain, and now they're diagnosed in the medical model with this disease. Now, actually, let me tell you something. I was in an ayahuasca ceremony once working with a shaman, and there was a person with severe ADD in the room. And the shaman said in the middle of the ceremony to me, 2 in the morning, he said, I just understood what ADHD is all about. He said, it's fear of the intense fear of the present moment. Why would somebody be afraid of the present moment? Because when they were small and helpless, they suffered. So that's addictions. I've often talked about it. Perhaps you're familiar with my view on it. Addictions are also not an inherited disease. Yes, they can run in families, but I mean, God's sakes, that doesn't mean that it's genetic, does it? I mean, if my kids became doctors, would that prove that the practice of medicine is a genetic disorder? I mean, it might be, but there might be other reasons why they became doctors. So something running in families doesn't prove anything. And if I gave you a definition of addiction, which I quickly will, addiction is manifested in any behavior in which a person finds temporary relief, pleasure, and therefore craves, but then suffers negative consequences and cannot give it up despite the harm. Pleasure, craving, relief, harm, inability to give it up. That's what an addiction is. The cases of crystal meth addiction went up, doubled in Australia between 2005 and 2019, for example. It can't be genetic. Then if you ask yourself, according to that definition, have you ever had an addiction? Most people will say yes. Not necessarily to drugs. Could be sex, gambling, shopping, eating, bulimia, self-cutting, pornography, internet, cell phones, work, whatever. And then if you ask yourself, not what was wrong with the addiction, but what was right about it, what did you like about it in the short term, you would say stress relief. You would say it numbed me out. You would say it helped me escape. You would say it gave me a sense of control. You'd say it calmed me down. You'd say it made me feel more alive. You'd say it made me feel more connected to other people, all of which are wonderful things. In other words, you just wanted to feel like a normal human being. The addiction wasn't your disease, for God's sakes. It was your attempt to feel like a normal human being. It wasn't your primary problem. It became a problem for sure, by definition, but it wasn't your primary problem. Your problem was the pain that you had to escape from. So my mantra under addiction is don't ask why the addiction, ask why the pain. And if you want to ask why the pain, you got to look at people's lives in their psychosocial context, including their childhoods, which is where trauma comes in. And I won't talk about trauma today. I'll just mention it. And finally, when it comes to physical illness, there's so much research linking rheumatoid arthritis, multiple sclerosis, malignancy, autoimmune disease in general, asthma, to stress, trauma, loneliness, all kinds of other psychosocial factors. It's almost astonishing how medical specialists never get that information, even though it's published in major medical journals. So yes, I've seen people heal from autoimmune disease through the use of psychedelics. I've seen people overcome addictive patterns through the use of psychedelics and to heal from depression, for example, through the use of psychedelics. Now, universally, no. Panacea, no. But really encouragingly high numbers, anecdotally, in my own experience, let alone the multiple studies that are not being done. Now, why do these things help? Well, if you come to me for an autoimmune condition, like say scleroderma, which is the immune system turning against the body and destroying the body, like all autoimmune disease conditions are, I might give you anti-inflammatories. If they don't work, I might give you steroid medications like cortisol. And if that doesn't work, I might give you medications to try and suppress your immune system, to blunt its attack on the body. And I've seen many such cases. And in all cases of autoimmune disease, there's significant trauma in the childhood history, self-suppression, pushing down of healthy anger, taking on of way too much responsibility in the world, automatic concern for the needs of others, ignoring your own, until your body says no, because you're not saying no. And you learned how not to say no in your childhood. It's not your fault. That became your survival pattern. So you come to a psychedelic ceremony. The cortisol that I give you, or the anti-inflammatory, or the immune suppressant, they just play with your physiology. They may work, they may not work. They may work for a while and then not work. But they don't change anything. However, you come to an MDMA session, or an ayahuasca session, or a psilocybin session. And I'm not that impressed with ketamine personally, but I haven't studied it very much. But you come to one of these sessions, you get to see, you get to experience your childhood fears. And you might get connected to your childhood trauma. Because what the psychedelics do is they remove this membrane. They remove this membrane between our conscious thoughts and our conditioned personalities and all the vortex of pain and possibility that we carry in our subconscious. So all of a sudden, we get to see ourselves clearly. It's like a waking dream, because dreams are always about the unconscious. And Sigmund Freud said that dreams are the royal road to the unconscious. Well, yes, they are. But with dreams, you never know what the heck they're about. When you're in a psychedelic session, in the proper context, and Tanya stressed the proper context. And one of the things that happened in the 60s, it wasn't only that the Nixon administration used anti-psychedelic propaganda for political reasons. There was also the genuine problem of a lot of people were using psychedelics in a completely irresponsible fashion. It was a bit like the sorcerer's apprentice, where the little apprentice gets a hold of the sorcerer's tools without knowing how to use them. So I'm stressing the importance of context here. So in that proper context, where the psychedelics open up your mind, and that's what it means, psychedelic, to manifest the mind. All of a sudden you get to see your mind with all its unconscious contents, but you get to see them as a conscious adult. So you get to see what you've been running away from, what you've been afraid of. You can get to see what you've been suppressing. And you get to see that maybe you don't need to. So that experience, along with the proper guidance that's attuned and safe and poised and practiced, that can put you in touch with yourself in a way that you've never been in touch with yourself before. And the essence of trauma is the disconnection from the self. So to me, it's not surprising at all that we should have promising results with addictions, with autoimmune disease, or with mental health conditions. The final thing I'll say is that a couple of caveats. One is, I'm really impressed that Australia has, taken the first big step in moving forward, but it's a limited step because they medicalized it. In my humble opinion, there's nothing about the training of psychiatrists that prepares them to deal with psychedelics as such. So to say that you can only do this under psychiatric guidance, to me, is a limitation, and it's a medicalization of something that to indigenous traditions was never medicalized. It was a much broader human experience. So I'd be very careful about the medicalization of this, restricting it only to a medical setting. The other thing I'll say is that for all their value, they're not panaceas, they don't work for everybody. And the third thing I'll say is I've also seen exploitation and abuse of people in a psychedelic setting, like I've seen in a psychiatric setting, in a spiritual setting, Christian, Buddhist, Jewish, doesn't matter. So these are powerful substances. They do make people very vulnerable. The context has to be pristine, safe, and very adept at holding people in their very vulnerable states that they arrive at under the influence of psychedelics. Now, I don't know for how much longer I've talked, but I think I stop here and just take questions.
Thank you very much, Gabor. Sorry, I'm just going to, can you pop this back up? Okay, just one moment. Thank you. By the way, Peter will say hello. Peter, do you want to pop your head in for a moment? Say hello.
Good day, Gabor.
Hi.
Just, wonderful, illuminating, insightful comments as always. We love hearing you speak and what you have to say. Of course, one of the really important things about the certificate in psychedelic assisted therapies that we are presenting is that it is really teaching the health practitioners, and there are a very broad array of health practitioners, as you know, to hold that space. And it's not just the clinical tools. I mean, it really is about how to hold people through what is a spiritual and mystical experience, looking at that whole mind-body spiritual connection, which you talk about so eloquently. There's an enormous amount of questions here on the chat. I'm going to start with this one, which came up earlier. How can we create caring, supportive community while living under the umbrella of capitalism, when people work hard and even hardly can pay the rent as a single person, where the recourses, where they mean the resources are not delivered fairly, only a small amount of people live with a lot of wealth and the rest are struggling and some are starving. What are your views on that, Gabor? I mean, obviously it's very hard, when we're trying to create a more equal and united society, which is what psychedelics is teaching us, that we are all one, and yet we have these huge inequalities in the world.
Well, those inequalities are part of the toxicity of the system that we talk about. So that, as I mentioned earlier, mental health conditions, autoimmune conditions, visit oppressed and people of color and minorities more frequently and with more devastating force. Those are not strictly physiological problems. I don't think I want to get into in this seminar with me giving you my social analysis and how to deal with all that, okay? I don't think that would be very helpful, because even if I told you it's not achievable overnight. And I think this is more like a clinical seminar.
Yeah.
If you want to read my general views about what's going on, there is my book, The Myth of Normal. But you
Yes,
know
which
what?
is
I think
wonderful, and many people are speaking your book in the chat. Everyone's
great.
saying get a copy.
So I think I'll chicken out from that question. Okay.
No, that's okay. It's fine. And we encourage everyone to read your book. It's absolutely wonderful, and all your books. Scotty, have you got I've got a good question here. How would you define holding space? Question
Well,
here
that's an
from
interesting.
Jarrah.
I love that phrase, holding space, because if there's anything you can't hold, it's space. I mean,
Yeah.
try holding space. You can't do it.
But how would you describe the container
No,
then that's
I
needed?
will talk. I will talk about it. I'm just talking about the contradiction in the
No,
phrase.
it's a funny
You know,
word, isn't it?
you can't do it. You can't get a hold of space. So what does it mean? You allow what needs to happen in an atmosphere of safety, where a person does not need to be afraid of their own experience. And really, all of trauma arises because we were afraid of our own experiences, because it was too painful and we were too alone. So holding space to me means allowing what needs to arise without interfering with it, but at the same time in such a way that the individual really feels safe in your presence, so that they don't have to be afraid of themselves anymore. That's what holding space means to me. And that means you need not to be afraid of yourself. So the most important work you do in this field is actually on yourself. Because anything you're afraid of in yourself, you're going to try and squelch your control in your clients. And then you can't hold space. So hold yourself so you can hold space. That's my quick answer.
That's a beautiful answer. And if I might, I think there's quite a number of people that have asked about your own explorations and your own healing through psychedelic assisted therapies. How have you done that for yourself? How have you held that space for yourself?
So psychedelics have been, they've opened up a whole world to me, inside myself, that I wasn't barely even aware of. And not to mention, you mentioned the mystical, spiritual aspects. Well, they've given me glimpses of that. I have not had the full-blown woohoo spiritual awakening that some people have had.
Still to come.
But who knows? You know what? It doesn't even matter. You know, it doesn't matter. There's no point looking for a particular experience. It'll come or it won't come. But they've taught me a lot about myself. Let me give you one example. Here I am, about to turn 80, exactly a month from today, actually. I think.
My God, you look so young.
Yeah, it's the toupee and the Botox and plastic surgery, steroid injection. It's amazing what they can do these days. In any way, so about 5 months ago, I did an LSD experience with a guide, and I found myself alone in the bathroom, and I called for her, and she didn't hear me. I experienced the worst panic ever. I was utterly afraid. Now, she came within half a minute, but those 30 seconds were like a lifetime of fear. And that was a memory of being an infant and being alone. And it was so good for me to experience that. It was so good for me to recognize how much fear was still in me. It was like a boil being lanced. So that's one experience I had not that long ago. And it was a difficult and a painful one, but my God, was it helpful. I could tell you beautiful experiences of wonderful messages in the sky, and I learned a lot from those as well. What I don't want to create is a sense that my healing has been strictly through psychedelics. They've been an important adjunct. And I think for all of us, they need to be an adjunct, not the thing. And the adjunct to what? To our lives. So they open doors for us. They give us vistas. They give us glimpses of ourselves, of our fears, of our joys, of our possibilities, of our pains. But it's in our life, day to day, that we have to integrate and incorporate what we learn. So I think I really have to emphasize the importance of integration here and of doing work outside the context of psychedelics. So don't put all your eggs into this one basket. Take from this basket what you can, which could be a lot, but the work is very much as much as on the outside as inside the psychedelic realm.
No, thank you. And you provide some outstanding tools. Sorry, go on, Gabor. Sorry.
Yeah, I was
cut
just
you
going to say, I think, not given that we know each other somewhat, I know that for you and for me, for example, our spousal relationships have been as important spiritual realms for growth than psychedelics, wouldn't you say?
Yes.
You know,
I mean, I think, having that deep connection with another human being for a long period of time is probably the best healing practice that you could ever have if you really take intimacy in all its fashions seriously. Yes.
and having to look at ourselves in that context.
Absolutely. And having that mirror reflected back to us every single day.
Exactly. So, yeah, so that's my response.
Okay, well, thank you. That's wonderful. There's so many questions here. There's one here. Do you believe that therapies like with MDMA, psilocybin, ketamine can reach a level of transgenerational healing as master plants like ayahuasca, for example, or are they therapies that temporarily suppress pain, or rather therapies that treat the immediate symptoms, but but not the cause of the trauma? How would the integration of that healing process take place, which is often complex, especially in today's rhythm of daily life where, people are so distracted and overwhelmed by everything?
Well, I hear several questions in
Yes.
your question. The first one is to do with multi-generational trauma. Is that right?
Yes. Yes. Mm-hmm.
Yeah. Well, look,
Mm-hmm.
first of all, practically speaking, virtually all trauma is multi-generational.
Mm.
That's just how it is.
Yeah.
When I was working with some indigenous people here in British Columbia, with mushrooms actually, they're so conscious of their ancestors. So when they have the experience, they're not just experiencing their own pain, they're experiencing their ancestral pain, and they even believe that as they heal, they're healing their ancestors.
Yes.
Now, I've heard other people say the same thing as well. Truthfully, I don't know exactly what they mean, but I don't have to know exactly what they mean for me to believe them, because they're talking about something that's very real for them.
Yes.
So psychedelics can heal multi-generational trauma, not just as it shows up in yourself, but theoretically and retrospectively, in a lot of traditions, you're healing older generations as well.
Yes.
And I'm not going to argue with that.
Well,
As little as my Western mind allows me to understand that, I'm not going to argue with it. Now, the second question in that longer question had to do with integration, did it?
yeah, how would the integration of that healing process take place, which is often complex in today's crazy distracted world?
Well, integration means actually you got to put it into your life, so that just going to a ceremony and having even the most beauteous and wondrous mystic experience soon becomes a memory unless you integrate it. Integrate it means to make it part of your life. That means you got to hang out with it every day. That takes practice. So you got to put some practice into your life. That every day puts you in touch with that realm. I don't mean using medications every day. I mean meditation or yoga or just some contemplation or some writing, or regularly online, perhaps speaking with the people that you did the ceremony with, and following each other and supporting each other and hearing each other, working with integration coaches. But in all cases, it means some ongoing commitment. I've participated in a lot of workshops, never mind psychedelics, just workshops. I learned beautiful teachings, but then I never did the practice. And pretty soon, what you've learned just becomes a very interesting memory. So if you want to integrate, you have to have some integrity. You have to make a promise to yourself and keep it.
Mm. It is critical. And there's other questions about that in the chat, and the insights that one gets through these healing sessions and ceremonies have to be brought back in and practiced, as Dr. Maté is saying. Otherwise, they do just become a beautiful memory and our lives don't change. And even in this very distracted and disconnected and divided world, we can find those moments within ourselves if we make that commitment to practice.
It is a matter of commitment. And in my own life, I found that when I tell myself stories like I don't have time, if I actually look at my time and how I spend it objectively, how come I have time to troll the internet for the latest football videos? Don't have time to meditate. I mean, these are decisions that we make, so that there's always time for integration.
Absolutely. I'm just going to answer one of the quick questions here about the cost of our CPAT course and other certificates.
Yeah.
Our CPAT course has a world-class faculty, and we generally remunerate many of the people on our faculty, and there's also a lot of costs for the intensive venue and just running the program. But as I mentioned earlier, we do provide financial assistance to those who have real need and can demonstrate merit and commitment to this field. So we are trying to make this training as accessible as we possibly can. And we're also trying to make the medicines as accessible as possible through the supply agreements that we have with a Canadian company. So Mind Medicine Australia is committed to making both the training and the accessibility of medicines in this space as affordable as possible. And that is absolutely our mission. So that's why we need support to be able to continue to be able to do that. Dr. Maté, Gabor, what is your opinion on the ongoing attempt to create novel psychedelics that remove the psychedelic element of the drugs? What do you think about that?
I don't know much about it, so I just don't want to comment on it.
Okay.
I'm not sure what these researchers might be about. Are you saying that to remove the
journeying aspect of the treatment? Yes.
Okay, I'm not speaking from knowledge. I haven't looked at it, so I don't have a considered opinion. My reactive opinion, and that's all it is that the journeying is a part of the journey. I mean, what else can I tell you? What they call journeying takes you out of just the physiological realm. And what sounds like they're trying to do some physiological change, that which really is a function of psychological and spiritual experiences. So if that's what they're talking about, I'd be very skeptical.
Yes, agreed. I 100% agree with you. There's a question here. Are you supportive of the notion that true connection with self, others, and place is imperative to healing? So rather than medication, it is the medications that foster connection that are helpful. That's the whole point. Yes.
That's the whole point. That it's not the medication. See, in the Western medical realm, drugs that we give out change the physiology temporarily, but they don't, which is maybe a good thing. It may be a good thing, maybe a necessary thing sometimes, but it doesn't result in transformation of your relationship to yourself. Now, given that the essence of trauma is disconnection from the self, and the very word healing means wholeness, that's actually what the word means, then surely an essential dimension of that wholeness is that reconnection with yourself, which you lost early as a result of traumatic experiences. So reconnection, and that's what people find, is they find themselves.
Yes. Scott, do you have
And by
a
the way,
question? Oh, sorry.
let me just add that finding yourself may have a spiritual dimension, because ultimately we are not separate human beings. We are part of a much greater unity. And that connection with that unity is actually finding ourselves.
Yes. And that's really where, we really need to go back to that sense of non-duality, that sense of oneness that we're all born with, and probably what we go back to when we pass on from this carnation.
Oh, that's good. That gives me something to look forward to.
Well, you never know, right?
I know what
Scotty,
you're saying.
Scotty, do you have a question there? Because I'm there's so many questions here that I'm having trouble sorting through them all.
There are so many. I do have a couple that I've grabbed.
Yeah.
I thought this was a really interesting one. Chronic pain affects 1 in 3, but advancements in medicine have failed to over time to curb this. As chronic pain is multifaceted, is all chronic pain interlinked with the mind in the same manner, or are different chronic pain conditions interlinked with the mind in their own manners?
There's so much research now, first of all, connecting chronic pain to childhood trauma. That's the first point. The second point is, when physicians look at chronic pain, they tend to look at the organ or the body part that's having the pain. But that pain actually is a mind-body experience. A lot of chronic pain is no longer generated from the part where we feel the pain, but it's a conditioned memory of pain. And so there's been a lot of work on mind-body approaches to chronic pain that don't just focus on trying to fix the part that's supposedly generating the pain, but actually deal with the mind-body connection, where the pain fibers from the brain and coming up and down are actually conditioned to experience the pain. And by working with the mind, we can reprogram those pain fibers. And there's been a lot of approaches. I could mention some of them, but point is, chronic pain, number one, is often trauma related, not just according to my experience, but also according to research. Number one. Number two, chronic pain is a mind-body experience. It's very much a brain-body experience. It's not just an experience generated from a body part. And people have experienced healing from surgery. I know people who've been told you're going to need surgery, you'll be on medication for the rest of your life. And they're not, either in pain or post-surgery or on medication. They just dealt with the mind-body aspect of it. Which is not to say that they were imagining the pain, they were genuinely experiencing pain. But the pain did not reside in the body part where the physicians identified it.
Makes sense. Scotty, another one?
Yeah, for sure. Do you have any comments on the relative effectiveness of some of the non-drug pathways that people use to access these experiences compared to drug or plant medicine pathways, such as breath work and things like that?
Sure. Look, I had one experience with holotropic breathwork. And as you know, Stan Grof developed holotropic breathwork because he couldn't work with psychedelics. He used to. And then along came those laws where psychedelic work was outlawed and made virtually impossible to pursue. So he developed holotropic breathwork. And what holotropic breathwork does, on a physiological level, it changes the pH level of the blood. It changes the acidity of the blood. And just by a couple of points changes in the acidity of your blood, you become a different person. So I did this holotropic breathwork, and all of a sudden my ego, which had filled my whole body, became this little creature on the sidelines, looking at this huge experience from a totally different perspective, just by changing my blood chemistry a little bit. So our sense of self that we're used to, that we believe is ourselves, is such an evanescent and, in a certain sense, artificial dynamic. And that could be changed through psychedelics. In fact, it is. It can also be changed through holotropic breathwork. For some people, it can be done through meditation. For some people, it happens through connection with nature. So yeah, there are the modalities. Probably none of them are as swift and as effective as psychedelics can be, but human beings have been having these experiences without psychedelics forever. I mean, the Buddha didn't take psychedelics. He just sat under a tree. And boy, did he have a trip.
And when Ram Dass went to India and gave a lot of, I think, LSD to his master, the master didn't really go anywhere because he was already there, right?
That's right. I wish I could take what they took.
Absolutely. Well, I recently, just by the by, I recently went to Bhutan on a leadership mission, and I never thought that I could say that I had an experience of healing that was on a par with my first experience with psilocybin, but this was in fact on a par with that. But I think that the psilocybin had opened the window so that I was far more receptive to this ancestral trauma healing that I went through. So yes. It is really wonderful what these medicines can do in terms of opening you up to healing, other healing modalities and the effects of those. Scotty, did you have another one there?
I do.
Yep.
I have a friend with whom I've had a hot and cold relationship with for over 20 years. We usually stop talking because he sabotages the relationship. He has addiction. I want to be there for him, but at the same time, I don't want to compromise my own well-being. How do you recognize balancing that?
Can I talk to the person or not?
Yeah, I'm sure you could. Who is that, Scotty?
If whoever asked that question is willing to come online and talk to me, just raise your hand and we'll.
Yeah, raise your hand and we'll spotlight you.
Use the little.
I don't want to give you a theoretical answer.
No, let me.
Vanda, here it is, Vanda. Okay,
yeah,
Vanda.
no. Can you unmute yourself and possibly show yourself? Is that possible for you?
Yeah.
Hi there. Now you need to unmute yourself.
Yes. Hey there.
Oh, Vanda, sorry.
Hey there.
Okay, yeah, there you are. Okay. So you're down below there. Okay, see you. Okay. So tell me the problem.
Basically, we've just gone we've gone so far back. I've known him since high school. He wasn't always like this. Over time, he's gotten more belligerent and more destructive over the relationship, and he'll come back. We'll start talking again for a few months, and then he'll disappear again because he'll just start attacking me pretty much he just finds reasons to. And every time he comes back,
attacking means insulting you or calling you
verbally. We're long distance. We're across the country at this point, so all we have is text and phone calls at this point. But after a while, just it's like clockwork. It's a cycle that I think we've grown almost used to this as our relationship cycle, which very unfortunate for me because I don't want that.
What's the question, Vanda?
The question is, it comes to a point now where I feel like it's affecting me, but I don't want anything bad to happen to him because I'm probably the one of the last friends he has. So I get to a point where I don't want it to affect me personally and my own well-being. But I also don't want to kind of let him.
So I'm not sure what this question has to do with psychedelics, but since you ask it, let me answer it anyway. Okay. What is the impact on you?
Just stress, really. Honestly, it makes me feel overworked and stressed out.
When you say just stressed, really, what do you actually mean? What's the impact on you?
Upset, angry. Just
resentment.
He upsets resentment to a certain degree. I'm just, it gets to a point where if I'm having a good day, we talk for an hour. He goes on one of his tangents. I'm not having a good day anymore, but I quit simply.
Okay. No, but first of all, just for a moment, if you just stay with me, get in touch with the actual impact on you. What's the actual impact? on your body, first of all?
I feel like it definitely weakens my immune system in general. I'm currently extremely sick, and I don't want to blame him for that, but at the same time,
Well, okay, so it affects your immune system. It gives
just
you
my
anger.
general,
It
yeah,
gives you
just my
anger.
general
It makes you feel
well-being,
bad.
and
Okay, all
I'm
right.
short fused. I'm short fused about certain things that I shouldn't be short fused about, and I can't put a finger on why,
Okay,
and I don't want
okay, here's my question to you. Are you willing to pay that price?
to. That's the I mean, that is the question, isn't it?
Yeah. Are you
For
willing to
right
pay that?
now, for right now, yes. For right now,
Okay.
yes.
Okay. If you want to make yourself sick, keep paying it. It's that simple. Your body's talking to you.
Yeah. I
Now
just feel like
listen,
if I wake up one day and hear that he's, dead or
yeah, he
gone,
might be. He might be. He might be. The question is that your responsibility? So listen, when was the first time that you took on other people's problems as your own and believed that you were responsible? That goes back to when you were 1 year old.
oh, very young. I come from a very large and
Okay.
loud and argumentative and clashing family. So yeah, I've been taking that on for quite some time.
Okay. That's what's making you sick. Now, it's your choice. But let me read you something, okay?
Yeah.
This is the American singer Sheryl Crow. Do you know Sheryl Crow at all?
Yeah.
Okay. She had breast cancer, okay? And she said, surviving breast cancer redefined who I am and how I am. Until then, I'd spent a lifetime being a caretaker for everyone around me. From then on, I started to take care of myself first. I had voices at the back of my head telling me that whatever I did wasn't good enough. Now, finally, I've silenced them. Wanda, my serious question to you is, do you want to wait to get really sick before you wake up? Because right now you're making a choice. You're putting somebody else ahead of yourself, and you believe that you're responsible for them. And that is going to exact a heavy impact on you. I'm telling you that right now. Now, I'm not telling you what to do. I'm telling you you have a choice to make. Are you going to take care of yourself, or are you going to take care of another human being who's not taking responsibility for themselves? So you are taking it for them. Now, I feel for your friend. I feel for you, feeling for your friend. But you have a decision to make. Which pain would you rather have? The pain of suppressing your own needs? Or the pain of losing your friend if that's what happens? That's the only choice you have. I cannot tell you which choice you should make. But I do suggest you read my book, When the Body Says No, for God's sakes. Because your body's already saying it. You're just not listening.
Yeah. Yeah, we have heard actually.
Okay, and thank you. And small world. And it really
Hey, look who it is.
and to finish this with psychedelics, you might really take this question into a psychedelic session.
Yeah.
Of what do I choose? Authenticity, myself, or my self-imposed responsibilities? That's the question for you. Okay?
Yeah. Very good.
Very
I
important.
would, I'm sorry, I would get a lifetime of anger from my wife if I just didn't let her cheat.
I'm Vanda.
Hi. Oh, you're
Just
Vanda.
me and my
Okay, hi,
wife.
sorry.
And I'm from Hungary too.
Oh, servus.
Yeah.
Okay, great. All right, thank you.
Thank you so much.
There's just a question here, Gabor, and I'm very conscious of the time too, so I know you've got to go to bed soon.
I have to go to bed
Here,
soon? Why do I have
well,
to
I
go to
don't
bed?
know.
It's
No,
only
you don't have to go.
7:30.
Oh,
It's
it's
only
only
7:30.
7:30. Oh, sorry. No, I think I'm getting confused with the time in another
Okay.
time. I think it was Bessel's time zone last week.
Yeah.
Question here. How about in relation to toxic elderly parents that are sometimes loving, but other times extremely critical and emotionally abusive, but they also lean on you for care and support as they are getting older?
They also, yeah. Well, that's a big question. My son Daniel and I, with whom I wrote The Myth of Normal, are working on a new book. The title is Hello Again, a fresh start for parents and their adult children. And this is based on a workshop that we do. In fact, we're doing it next weekend in California.
Mhm.
This question comes up all the time. I can't give you, excuse me, a rapid answer, but I'll give you a succinct one as I possibly can. If you can accept that your parents are the way they are, which is fundamentally flawed and in some ways deaf and blind, and they can't see you for who you are, and they never could, because they were always deaf and blind, not their fault. That's the trauma that they carry. If you can accept, I'm sorry, that that's who they are, and you can't change them, and you're not going to resent them for the way they are, then you can look after them. But if you're going to continue to resent them for the way they are and for the way they hurt you when you were a child, and you might have all kinds of anger about that, and if you can't let go of it, then looking after them will just choke you with resentment. So my suggestion is work on yourself so that you can get into the present and not be affected and controlled by your childhood relationship with these people. Then you can be an adult, clearly seeing them for the limited human beings that they are, and still love them if you can, and look after them. If you can't, you're going to suffer a lot. So I'd say work on yourself.
And it always comes back to that, everything.
Yeah.
Everything that you're saying. Scotty, there's some other burning I mean, there's so many questions here that because I'm trying to listen to Gabor and have you got any others that there's still people entering the webinar now.
There's one great question that's just been asked from someone who's been experiencing grief recently and feels as though it's triggering old traumas. Do you have any comments on the connection between grief and trauma?
Well, trauma actually is grief that we haven't experienced. So in childhood, we actually have a circuit in our brain for grief. We share certain emotional brain circuits with other mammals, for joy, for caring, for love, for play, for curiosity, seeking, for lust, for fear, for anger, and for grief. Because life brings losses. The best life will bring losses. And we have to be able to grieve them. And grieving is like a gradual letting go and accepting the futility that you've lost something that you're not going to get back. That's a healthy process. We have to be able to grieve. Animals grieve. Now, in childhood, however, when we lose the parent, not in the sense that the parent dies, but in the parent that the sense is not available, there's tremendous sadness, there's tremendous grief. If the child could be helped to experience the grief and supported in it, it wouldn't be stuck in them. The reason we get stuck in these old patterns is because we can't grieve, because for grief we need support. So a lot of trauma is unprocessed grief. Now, when something happens in the present, now when I was working in palliative care, looking after terminally ill people, what I noticed is that sometimes families, some of them would want desperate measures to keep that parent alive, and other children in the same family were much more at peace letting the parent go. Now, paradoxically, you think that the kids that had trouble letting the parents go were the kids that were closest to the parents, and the kids that were more at ease with the parent actually dying would be the kids that weren't close to the parent. It was the other way around. It was the kids that had the worst relationship with the parents in childhood were the ones who had the greatest trouble letting go. Why? Because the pain of losing the parent, they had already experienced at a time when they couldn't grieve it. And they were afraid of experiencing that pain again. So if they could grieve and let go, yeah, I didn't have the parent that I needed. And that's very sad. And I have tears about that. then the trauma doesn't get stuck. But if there's unresolved grief, then something in the present, some loss in the present, can trigger that unresolved grief, incomplete grief. I know this is complex, and I don't know how clear that explanation was, but I have a wonderful friend of mine, Gordon Neufeld, a child psychologist with whom I wrote one of my books, and it's actually his book. It's Hold On to Your Kids. It's a wonderful parenting book, but I wrote it with him, and he says, we shall be saved in an ocean of tears. And if you go into a psychedelic ceremony, boy, do you have people crying, don't you, Tanya?
Yes.
People are grieving for the first time, and it's a
Mhm.
flood of grief that washes out the
Mhm.
trauma.
Mhm. Mm.
So that's my quick response.
Oh, thank you very much. We know that there's a lot of questions, and Gabor, do you have time for a couple more if we have a couple more?
Yeah, I'll give you 2 more minutes of overtime.
Thank you.
But I
Scotty,
always
you have
I charge double for overtime, you know that.
Gabor, Scotty, do you have any other ones that you really want to that are sitting there that we want to ask?
One that I think is an interesting one that came in is, do you have any suggestions on choosing plant medicines or for people in terms of what is appropriate for a different person, for different people, whether that's based on what they have going on or anything else?
I do sometimes make specific recommendations, but I really have to know a person very well. I can't just give you a general recipe. If in doubt, I suggest they start with the milder modalities like low-dose psilocybin or MDMA. But I might recommend some of the big guns, if you like ayahuasca or iboga or something, depending on the situation. But I have to know the person well before I can make that determination.
And a few people have asked about MDMA therapy, which we haven't spoken about particularly in detail today. Is there anything? I mean, obviously, the work of MAPS with MDMA-assisted therapy has been profound and very important. Do you have any particular comments about the use of MDMA, particularly for trauma and addictions, which is obviously a huge area of your expertise, and anything about using MDMA so that you can just give a more general comment about it to the audience?
Well, yeah. Addictions in general are attempts not to feel certain things because we're afraid of those feelings. So I don't want to feel the emotional pain, I use an opiate. I don't want to feel my listlessness, so I use a stimulant. I don't want to feel the scrambledness of my mind, so I'll smoke some pot. But they're attempts not to feel or to feel different. The MDMA, as I understand it, kind of relaxes the fear center in the brain. So all of a sudden, you can have those emotions and not be afraid of them. So once you had the experience of having an emotion and realizing you don't have to be afraid of it, that would obviously help you not have to escape in the future. Now that's the theoretical answer, and I don't think it happens overnight, but in that sense, I can see MDMA helping addictions. And my attitude towards all this research is, well, I know we have to do it to convince the authorities and develop protocols and write double-blind studies, but you know what? I'm too old for that. To wait for all that stuff, I'd be very confident. I'd be very confident had I the time, which I don't, but I'd be very confident to take on somebody with addictions and to try them with MDMA a few sessions and see where that would take them. I can see nothing but good coming out of it. I don't see the downside.
Absolutely.
So, we have to be evidence-based. I understand all that, but on the intuitive level and the experiential level, I can see MDMA as helping addictions.
Yeah, and it's also obviously incredible for trauma in terms of, you know, stopping bringing the past into the present constantly, allowing that closure, that acceptance of the trauma and not forgetting it, but being able to move forwards. And that's one of the really important things about a number of these psychedelic assisted therapies. Held in the right circumstances with the right dose in the right set and setting is critical. Well, Dr. Gabor Maté, I think we've been very blessed to have you here with us today, and we wish you a good evening, and I look forward to being in touch soon. In fact, I'm going to reach out to you about a couple of things shortly. But we're
Wonderful.
very grateful for your support and friendship, and to Mind Medicine Australia and our entire community. And congratulations on everything that you're doing. Your book is absolutely wonderful, and I've bought a lot of copies for a lot of people as Christmas presents. So thank you for that, and you must be very proud of what you've achieved. And if everyone could just show your appreciation in whatever way you can to Dr. Maté. We'll be sending out a thank you note to everyone who's registered for this session. We know a lot of people have not been here physically, but are going to watch the recording. And I will send out some links, and we'll also send a link, obviously, to your books and your other work. And we look forward to being with you again very soon. And to all of you, thank you for supporting this community. We do need to create change on this planet and a greater sense of connection and oneness. So thank you all. Blessings.